Give us some insight, because you've advised public officials in situations like this. It's hard because you're a public official, you want to encourage hope, whether it's a new treatment that's possible, like the remdesivir issue, or whether it's some other treatment like we heard yesterday about sunlight and disinfectant. How do you allow people to encourage hope without distracting? How constructive or potentially really troublesome is it when public officials suggest things like we should use disinfectant?
Yeah, David, it's great to be talking with you. I think you have to be really careful. And one of, I think, the best approaches to that is let science be discussed by scientists. Put forward your best public health scientists. And, we've got Dr. Fauci there. It'd be great to have a leader from CDC out there as well. And let them talk about what's being learned scientifically. It's so easy to fall into the trap of false hope, putting forward ideas for miracle cures when the science hasn't been done yet to know whether or not any of these things even work. And I worry that so much of what we read is driven by press releases that are geared towards stock prices rather than science fact, which is geared towards trying to improve people's health.
And Richard, it strikes me, you never want to get up false hope because you have disappointment, but here the consequences might be more serious than that, because if people believe this, they might change their behavior and actually try to move away from social distancing too soon.
Yeah, one of the challenges by not hearing from public health scientists is it makes it hard for the public to decide what to do in a fact-based way. So for instance, the CDC changed their recommendation regarding people wearing masks, and says now that people going out in public should wear a mask, a cloth mask that they could make at home. Well, that really has to be shared in a careful way, because the science in terms of how much extra protection you get from a mask is very, very weak. And so you wouldn't want to see people saying, wow, I'm wearing a mask, I can go out now, when before I wouldn't, when the safest thing is still to try and minimize the amount of contact you have with other people, keeping 6 feet away. Hope is really important. And I think one of the ways people remain hopeful is by believing that our public health officials are working hard to learn and to adapt based on the best science, and that our policies and our decisions at that level are being driven by the best public health science.